Super excited to have you on today and to finally be meeting in person for the first time.
I know. It's been a few years of just Zoom meetings, so I'm really happy to be here too.
Definitely. So to start off, would you like to tell us a little bit about your first poster here, the AYA-APP collaborative? For background, what are some of the unique unmet needs, and why did you decide to design and launch the collaborative?
Yeah, so I'll first say I know there's a lot of acronyms in oncology. So AYA, Adolescents and Young Adults, we typically consider them cancer survivors who are diagnosed time of diagnosis till end of life, and it's an age-defined cohort. So adolescents and young adults, we think of those who are diagnosed between the ages of 15 to 39 years. And then the APP part of that is advanced practice providers. And so this group is really focused on nurse practitioners. And Melissa Matson is really the one that spearheaded this group. She's an oncology nurse practitioner at UNC. And back in 2020, she was speaking to a few other AYA APPs across the nation and had met at Congress like this, had met at some AYA conferences, and there was this just concerted need to really support advanced practice providers, nurse practitioners in the AYA practice setting. And so she started this group, started with, I think it was about 5 folks, and started to then just reach out to different AYA programs across the nation, and then really extended it to also folks who are doing research, who are oncology nurse practitioners like I am, who are doing research with the AYA population. So it's grown now. I think we're right around about 30 folks in the U.S. and in the U.K. And we know that in the practice settings, there's a lot of resources to support oncologists and even registered nurses in caring, but it's the role of the nurse practitioner for AYAs that is really like kind of this in between. There's not specific professional organizations for AYA APPs, and there was this ground roots effort to say, hey, we have this clinical problem, or Melissa's example is, we need more resources for AYAs about fertility preservation, and we are having these conversations in a way that's different than oncologists and nurses. And so, how can we help navigate them to these resources? And then when they're prescribing, when they're really managing the care of AYAs, and have questions about, this patient was on this medication, and they do have questions about their fertility, or even, around with a lot of legal implications for fertility preservation and restoration. It's just this group that comes together, email, in person. We have these monthly meetings, and really bounce off just a lot of clinical questions, a lot of research questions. And so that was really what the ground roots effort was. And now we're being asked, to speak at different conferences. I spoke last year at ASPHO. We have a lot of other, organizations too. We have this first poster this year that's really presenting on just the growth of it, the idea behind the development, and then kind of what we're doing and how we're coming together. So it really is, if you are an AYA APP and you are just looking for a group that really gets you and wants to be supported, definitely join us. Come to our poster. It's online on ONS Congress, and you can sign up, and then you can be in our listserv.
That's really amazing. It's such an important initiative. Thanks so much for telling us all about it.
Yeah.
So what are your goals for the future of the collaborative and similar efforts?
Yes. I think, there's talks on to how we can better integrate AYA APP practice in clinical settings, but then also, are there specific models like UNC and the AYA program there has a really dedicated model to how the APP functions in the clinic, how they work with researchers on the team, how they work with the oncologists, and also how they work with different schools within the university, like the School of Nursing, Medicine, Social Work. And so the hope is that we can grow this group to really capture the voices and experiences of AYA APPs across oncology settings. So a lot of community oncology sites, which we don't have that representation right now. And then also programs that don't have dedicated AYA programs yet, that are looking to, leaders like Michigan, like UNC. How is it that you were able to get leadership buy-in to support this dedicated group? And then how is it that you're supporting research too? And so I'm very much interested in that, and me and a few others have kind of helped Melissa with how we can set up kind of like a landscape needs assessment to where are the AYA APPs now, how are we reaching out to them, who are we missing, and then what are the specific needs that they want addressed in their practice sites. And so it's good to be in a setting like this. We're hoping that next year we can actually distribute that survey so they can complete here.
Great, it's really incredible. I'm looking forward to hearing more about the collaborative as it goes on, and looking forward to hearing more in your poster as well.
Oh, thanks.
Great. Awesome. So I'd love to hear about your second poster also.
Yeah.
So for a little bit of background, what are some of the unique challenges faced by sexual and gender minorities, or SGM, AYAs with cancer?
Mm-hmm. And we always talk about this as, so sexual and gender minorities, you probably don't refer to sexual and gender minorities in the public and population. And when we work with community members, it's like, who is a sexual gender minority? Why is the research world kind of identifying us in that way? And so sexual and gender minorities are those that identify as LGBTQ+, lesbian, gay, trans, bisexual, asexual plus. And research, as we always do and like to complicate things a bit, we've tried to think, okay, is it sexual and gender diverse, sexual and gender minorities? Is it important how we capture this diverse population? And so I want to start with that because we just did a needs assessment with ESCAPE, which is an AYA LGBTQ group, and immediately they're like, we don't want sexual and gender minorities on this publication. We'll do sexual and gender diverse. But so there's a lot that's going on with the adolescent and young adult population to begin with. We know that there's increasing incidence in this population, and we also at the same time know that they are surviving longer into adulthood. I'm very interested in issues around quality of life and survivorship needs. But also at the same time, you have this growing group, and you also have growing diversity in that group around sexual orientation and gender identity. And so I think that was the Gallup poll a few weeks ago that was just put out that we have the most, diverse in terms of sexual orientation and gender identity in this population. And so we have this group then, they are young adults, they identify as LGBTQ+, and then also they're layering cancer on top of that. And then so they're figuring out not only at baseline how to navigate their identities, but then also trying to figure out what it is like to be an adolescent and young adult diagnosed with cancer and all of the complexities that come with that. So about 2 years ago now, I was a postdoctoral fellow at the University of Michigan. I was working with folks like Dr. Brad Zebrak in the School of Social Work and Anao Zhang from the School of Social Work as well. And we knew that we wanted to have a focused study that looked at partnering with community-based organizations, academic medical centers, and real SGM community members. And so we submitted to PCORI, the Patient-Centered Outcomes Research Institute, in this funding mechanism called an engagement award. And so they're very interested in patient-centered outcomes research. And so we submitted it under this idea of let's partner with these. I mean, if you think of them as three sectors, the academic sites, the clinical sites, community-based organizations, and community members and researchers that kind of work throughout that. And let's do this project in a way that is really co-developed with community members and community partners. And so we got funding for that back in 2021. We're about halfway through the project, and it's split up in two separate phases, where the first one is doing interviews with LGBTQ AYAs and BIPOC AYAs. This poster is just focused on the LGBTQ AYAs. And then we put together a community advisory board of 10 underrepresented AYAs, those that identify that as LGBTQ and or BIPOC. And the second phase is what we're really in now, is quickly, and thoroughly analyzing the qualitative data from these interviews, and then setting up for a 2-day symposium in June. And the findings we're asking about what are the facilitators and barriers, what are things that have helped you or things that really prevented you from engaging in research or engaging in your community-based organization or engaging in true psychosocial care through your your cancer organization. And we know that their answers are what we call they're multi-level issues. So there's things obviously at the individual level as the young adult LGBTQ cancer survivor to say, it's the time too. Like that, I have to make sure that I have time to participate in either research studies or clinical activities, and I need to find meaning in it. I need to, there has to be something that it's like, okay, is it something that is for me, that I can better understand myself by participating in this research, or is it something that perhaps can contribute to producing more knowledge for future, queer and trans AYAs with cancer. And then at the institutional level, it's really around like, do other providers know about other studies happening, based in, I was at Michigan. Do they know about studies happening at UNC? Do they know about studies being done in true community partnership with these AYA cancer organizations? And so we're, again, analyzing that. We have some like preliminary stuff in the poster, and then we are setting up at the same time these like design thinking workshops, we had a few this week, where the University of Michigan has this design lab called MISHAR, and so we have a few members of our team, and we're looking at the qualitative findings, and then we're mapping out through these like system and journey maps, how is it that a LGBTQ AYA progresses through not only their cancer survivorship, but what are the touch points that they have with their clinicians, whether they are oncology, APPs, or physicians, or social work. Where is it that opportunities for research engagement are being brought up, and then also at what is it appropriate at all these visits to say, hey, we know about these studies, would you be interested? And so it's been interesting, and I've been learning a lot about how to really conduct research with true participatory based participation. And especially my community advisory board, it has been teaching me a lot. We talk about this too, of like the secondary effect of when patients are involved in research, how they are able to translate that experience back to whether it's their own professional roles. We have someone who's a graphic designer. We have somebody who works not as a nurse, but in healthcare, and they were like, I actually participated in our research symposium and shared my experiences on the community advisory board. So it's all of that is being captured in a way through these post-evaluation surveys, but to answer your original question, you said, what are the unique needs of LGBTQ AYAs? We know that they are a bit different than cisgender and heterosexual AYAs. We know that there's perceived discrimination that they experience. We know that also their support systems will look different. So there's a lot of reliance and just assumption that you're diagnosed at 18 or 22, and perhaps you can move back in with your parents, or perhaps you can get this financial support from other family members. If you had recently come out, or if you are out in a way, and you're not accepted, if there are fears of familial rejection, if there are fears of even perceived discrimination from your oncology team, all of that affects your quality of life, and all of that affects how you're accessing your care and how you're further, engaging in your experience as a cancer survivor. So all of that has come up in the interviews too, and so I think the one thing I can reflect on just right off the top of my head is how important is it to, in this case, how is important to oncology nurses when they see an adolescent and young adult, and is it important to them if they're not coming in truly authentic with who they are. And so from our interviews, we've heard from these LGBTQ AYAs that some of them are like, I know my cancer's already rare and complex. I am not feeling well, and I'm just gonna go into this appointment and not talk about that, I have a partner or that I'm trans. And it's been I talk to now my co-lead about this all the time, about like, this is really important data. This is really rich qualitative data, and we want to make sure that we do right to the participants and to the larger LGBTQ community with how that is being translated. So this is just one little piece of, not really presenting on all the findings, but kind of setting up, this is what this project was about. This is how we're authentically engaging with the community members and how we're working across different stakeholder groups, and then kind of stay tuned for our findings next year. Yeah.
Absolutely.
I know this is a long-winded answer.
Not at all. It was so interesting to hear about. It's so exciting that you've developed this approach as advisory panel to really address these needs. So it's such important work. So
thank you.
Awesome. Well, thanks for telling us about both of your posters.
Yeah.
My final question for you is, since the theme of ONS this year is Ignite the Extraordinary, how do you personally fuel your own motivation as an oncology nurse and also help ignite passion in the nursing community?
Oh. So I laughed when you said that because I knew what the theme was. I registered, applied for the abstracts, and then I walked in and there's like that huge banner, right, when you walk in through the convention center. And I was like, oh, like it is, it's going to sound very corny, but it is like really, really compelling to be in a place like this where you have all of these really dedicated oncology nurses who are not just doing one thing. And an oncology nurse, a nurse in general, is not just one thing. And so I think, I feel very strongly that and I'm looking at it now and the banner across, that the motto is the slogan, whatever you call it, is very compelling for this year because there are different trajectories that oncology nurses can take, and each of those, each of those are extraordinary in their own ways. And so I get excited as like an early career nurse scientist to see opportunities like this, like being invited to your board, and also have a voice for not only oncology nurses, but oncology nurses doing research in this space. And I'm excited to hear, like, just even throughout the next few days, how folks from all these different cancer centers, all these different backgrounds, are seeing themselves represented in like how they're fueling. I also like to think, okay, you're igniting the extraordinary, you're fueling your own passions in a way. I think back to like just like finding your why, and something I talked about a few years ago. I think it's just going back to like what it is that really compels you to do the work day in and out that you are doing, whether that's at the bedside, whether that is in a lab, whether that is in the community with patient advocates, across the street, in policy work. We have nurses on the Hill. All of those things are really moving our profession forward as nurses.
Absolutely, and we're very grateful to have you on our editorial board as well, and help to ignite the extraordinary for our audience.
Thank you so much.
Yeah, well, this is wonderful. It's great talking with you today.
I know, great talking with you as well. Thank you. Thanks, Wilson. Wilson fell asleep.
So put him to sleep.
Thank you.
Yeah.